Hello and welcome to Ask the Doctor. I'm your host, Mike Berger. Here to answer your questions on pain management and alternative pain management today is Dr. Robert Bulger from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. Just call the number that you see on your screen. It's 1-888-572-4411. Or you can go to the website, www.southwestpaingroup.com. Dr. Bulger, a lot of my friends suffer from chronic neck pain. And tell us a little bit about that. Is there something that causes that? Is age relevant to that problem?
Probably the most common cause, Mike, of neck pain is degenerative disc disease. In fact, in patients over the age of probably 30, all of us have a degenerative disc. It's just a matter of time. And it's basically a dehydration of the disc. But other common causes of neck pain would include facet symptoms. Facet joints are special joints in the neck that are gliding joints that can become arthritic with age and time. But a lot of times it's just musculoskeletal. It's just simply a muscle pull or something we've done in the garden or sports.
A lot of times, is surgery the only thing that can help or cure that, or are there alternatives?
Well, that's a pretty open-ended question. The fact of the matter is that only about 5% of spine problems require surgery. The other 95% can be solved with conservative care. Things like therapy, chiropractic, physical therapy, exercise, sometimes injections, medications, and often, though, it's just a matter of lifestyle modification, identifying what's causing the problem and then trying to fix it.
You know, I've talked to a number of people who've had different types of back problems. Some doctors have told them that surgery would help them. And then I've heard from a lot of people who say, don't have an operation on your spine or on your back unless it's absolutely necessary.
Well, I think part of the reason that people have a fear about surgery is that perhaps in the past, surgery was offered perhaps too quickly. But I think now, particularly in the last 5-8 years, there's a real emphasis on what we call evidence-based medicine. Mm-hmm. and spine surgeons, and we're fortunate in Dallas-Fort Worth, we have great spine surgeons in this town, some of the best. And they're really tuned into this. They really want to identify the people that will benefit from surgery. So it's less of a problem, but I think in the past, perhaps there was more surgery than needed. And unfortunately, sometimes, even though the surgery may be technically successful, people may still have some pain afterwards.
Okay, Dr. Bulger, we've got a lot of great things to talk about today, so let's get to our first question. Just a reminder, you can call the number you see on the screen. It's 1-888-572-4411, or you can go to the website at www.southwestpaingroup.com. The phone lines are open, so let's start out with Margaret. Margaret's in Allen, and Margaret, what is your question?
Yes, I would like to know, I have nerve damage all down my right side, my waist down, and the pain is so severe. And they're trying right now to see about working with it with, well, I've been taking therapy and that doesn't work. And they said they could maybe go in there and do something to my back. And I don't know what they're really talking about, but I'd like your opinion. Do you think that since it's nerve damage and you know they cannot do anything about it, do you think I ought to just let it alone? Or what? No medicine helps it, nothing helps it. It's just, I cry a lot.
Well, Margaret, that's a very, very good question, and it addresses many things. First of all, we need to find out why you have nerve damage. Why does she hurt? Because there are treatments for nerve damage. What's the damage from? Is it from the prior surgery? Is it ongoing? There are medications that can help that. There are treatments. Mm-hmm. And she said therapy. I don't know whether it was physical therapy or what was involved there. But Margaret, there are medications and treatments for you. But the first thing is diagnosis, and you need to come visit us and get to the bottom of why you're hurting.
And I think it's so important when people do come to see you, because we're laymen. We don't understand what you know, or we don't understand the terms and everything. So you've got to talk to that doctor. You've got to say, wait a minute, explain it to me so I'll understand it. That's so important.
And there's no substitute for physical examination and face-to-face evaluation.
All right, the phone lines are open. If you aren't able to get through, you can keep trying. Dorothy's with us from Irving. Dorothy, go ahead.
Yes, I've had 2 back surgeries, and the doctor took out too much bone in my back. And they say I need a rod in my back, but they won't do it because it says they take it too long and I live by myself. Is there anything else that can be done for this? Because I'm in constant pain throughout my whole body. Thank you.
Well, you're very welcome. This is an important question. You have to be careful here, because if in fact you have too much bone out, that might mean you're unstable. If your spine is unstable, you probably do need to have that stabilized. And oftentimes the only way to stabilize an unstable spine is with some kind of supportive corrective surgery. And you're really going to have to rely on your surgeon. And we have great ones here. You might want to get a second opinion. Most top surgeons are welcome second opinions. And in fact, insurance companies require it. Because, Margaret, I think it'd be very important not to put this off. If you're in constant pain, you may need that surgery. So there are times surgery is necessary, and this might be one of those.
Great questions, good answers, Dr. Bulger. We're going to take a short break. When we come back, we'll be discussing the benefits of pain mapping. Stay with us. And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today, Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411, or you can visit the website at www.southwestpaingroup.com. Dr. Bulger, this looks kind of exciting to me. We're going to talk a little bit about pain mapping, and I'm not familiar with that at all. What does it have to do with?
Well, it's actually a kind of a new term that's popular, and I think it's because people don't understand the complexities of diagnostic blocks. But essentially, pain mapping is a way for us to find out why people hurt. Because you can't, like Margaret, our caller before, you can't help fix a problem if you don't know where it's at. Pain mapping is essentially this. It's using our knowledge of anatomy, the patient's exam, and our knowledge of nerve blocks, and using discrete nerve block therapy to identify a pain generator. And a pain generator essentially is the tissue that's most likely involved with the pain. And I'd like to give you some examples which will help people understand it better.
I would just like to ask the question, am I correct in understanding that sometimes pain can come from a totally different area, and that's why this can be so important for people?
That's exactly right. This first diagram here for the viewers, this is called a dermatome. And a dermatome is an area of the body that is subserved by a spinal nerve, and it's kind of the first step in helping map out where the problem is. And each of these different colored areas, Mike, corresponds to a different spinal nerve. So let's start out with some examples which will help the viewers understand the concept of pain mapping. Now, the first case is a 41-year-old lady who came to us. She'd had a hysterectomy about 2 years ago. Now, the hysterectomy went well. There were no problems with the surgery, but she continued to have abdominal pain and groin pain. Now, our obstetrician told me, hey, the surgery went great. I don't know why she hurts. You know, I don't want to keep writing her pain pills. She came to me kind of looking for answers and really basically resigned to the fact that she probably going to have to take pain medicine. And that's not a good thing to have to discover. Well, as it turned out, her pain didn't sound exactly like incisional pain, but if you look on the diagram right here for your viewers, it actually mapped out in this area by her incision. But it was a little bit different than typical pelvic pain. So here's what we did. And I'm going to show your viewers right here. If you look on the spine, different areas of the spine, different spinal nerve roots correspond to different parts of the body. As it turned out, when I did an MRI scan on her, of course we needed to scan it. I'm going to pull this off. Thanks, Mike. I found out that she had 2 bulging discs. Now, the bulging discs were very mild. The neuroradiologist thought, well, this probably isn't the cause of her pain. So what did we do? We wanted to do the diagnostic mapping. And what that involves is essentially, if you want to take a look right here where the red arrow is, we take a small amount of medication, and for the viewers, we place that medication on the nerve root. So I put a few drops of medication right on that nerve root. And then we wake her up, and we had the lady walk around. We had her move around and see how she felt. As it turned out, she wasn't much better. So we brought her back, and we did the other nerve root, the other one that corresponds to the bulging disc. And it's very important to understand something that we've learned. It's exciting stuff, too, because sometimes a disc that's bulging or doesn't look like it's much of a problem can be. So interestingly enough, after we did her her T12 and L1 root block, it turned out that she had a bulging disc that was irritating the nerve. And if you'll lift up that post for me again,
Sure.
Mike,
Sure.
for the benefit of your viewers, in fact, her pain wasn't from her hysterectomy at all. That was a successful surgery. She, in fact, had a bulging disc which was masquerading and causing her to experience pelvic pain and groin pain. Now, that's an example of where we can help someone. And pain mapping allowed us to tell her, look, you're not crazy, you don't need Paxil or Prozac or pain medicine, we can get you better.
Well, she had to be thrilled with that.
As it turned out, we were able to treat this conservatively. She did not need surgery.
Now, you said you had another example for us. Let's get to that one, Dr. Bolger.
There's another example. This was a 52-year-old gentleman who had neck surgery. We talked about neck surgery.
Sure.
And he had a cervical fusion. And so for the benefit of your viewers, he had a C5-6 fusion. And many of you know about neck surgery. Peyton Manning had neck surgery recently. A lot of talk about all his troubles. But in fact, this man's surgery went very well, very well. But interestingly, about 5 years down the road, he began to have pain. Now, the surgery was fine. It wasn't clear to the surgeon why he was hurting. And when he rotated his neck a certain way, he had symptoms that suggested that perhaps this might be nerve irritation. So much like our first lady, we did a diagnostic nerve block to map out this pain. Well, it turned out it didn't change his pain. So the first thing we learned, and it was really interesting, and that's why I actually love this specialty, because it's almost like detective work. It's literally like CSI. It's a way for us to find out where the pain's coming from. And I want to emphasize to your viewers, we work together with some of the best surgeons in Dallas. We're very fortunate. Top surgeons at the Carroll Clinic and Texas Back Institute, many other great surgeons in town use these techniques. And we found that, in fact, his pain, was coming from joints above and below the fusion. So in fact, we were able to do a diagnostic pain block, and we put a little bit of medication right there, a little bit of medication right there on these two joints. We woke him up. And by the way, just for your viewers, people are very comfortable with mapping. We do it with patients comfortably sedated or asleep. So you don't have to be awake for this, which is nice.
Sure. And I think also, Dr. Bolger, because we're running a little short on time, you had some video that you wanted to show us?
Oh, yes, yes. I'd like to let your viewers go ahead and take a look at what a typical mapping session might be. At Southwest Pain Group, we frequently use MRI scans and the diagnostic blocks as part of a total program. And the program involves trying to figure out where the pain's coming from. We use ultrasound, imaging studies, and physical examination. And every patient ultimately has a mapping session and then a discussion where we go through the possible causes of the pain. It's something that we do for every patient at Southwest Pain, and it's probably one of the most exciting and interesting parts of my work.
I'm just going to ask you a question. I know every case is different, but if we were talking about a time to do this, what kind of time were we looking at? Would it take an hour, maybe 2 hours?
Sometimes these sessions can take several visits because it's important to try to figure out what you hurt. And so it might require several sessions to get to the bottom of it, because really we're using evidence, just like a detective solves a crime. We're trying to find the bad guy.
So you're doing everything it can possibly you can possibly do. Find this, help them.
Locating the pain generator is the first step in really helping solve someone's problem.
Okay, we have a number of questions regarding pain mapping, and we're going. If you'd like to make an appointment, you can go to the southwestpaingroup.com, and we're going to be right back in a moment with those questions and some answers. Don't go away. And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today is Dr. Robert Bolger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411. Or visit the website at www.southwestpaingroup.com. Doctor, we talked about this pain mapping today, and every time we get together, you come up with some new and interesting things that are taking place. What's on the horizon? What are some big changes that you've seen or that you're looking for?
Well, I think one of the most exciting things about pain management for me is the fact that it's really turned into a specialty in of its own. When it started out in the 1950s and 60s, it was just an anesthesiologist doing a nerve block once in a while. You might be a surgeon that'd call me and say, hey, Bob, I got a lady in the recovery room who has pain. But now it's actually turned into a complete specialty. We're consultants. We help try to find the pain with pain mapping. We're using things like ultrasound, working with surgeons. It's an exciting field because we can actually integrate your complaints, our knowledge of neuroanatomy, and all the other exciting tools we have to give people answers. You don't have to just tell people, well, we don't know why you're hurt, just take these pills.
So if we take a section of time, let's say the last 40 years, we've gone from, well, we can make the pain go away for a while, or we can put you on medication, to we can actually do something about it and hopefully fix it.
We can't always cure pain, Mike, because sometimes there's nerve damage or structural problems we can't fix. But being able to tell a patient why they hurt, that's actually comforting, and there's a lot to do. There's a lot we can do to help it, and that's why it's called pain management. Obviously, I wish we could cure everybody, we can't, but we can sure help people get closer to the cause.
Now, I would like to go back for just a second to the pain mapping that we just talked about. This is a very interesting area. So who came up with this, and how has it evolved?
Well, actually, it's interesting. It's actually an offshoot of what we've always been doing. When I came here about 20 years ago, there were surgeons I was working with who were calling me and saying, look, I think that C7 nerve on the right is the one. Can you do a block and find out? And it kind of evolved from that. It was working with surgeons who have great knowledge of anatomy, of course, and trying to locate the pain generator. And it's called mapping because people can put their arms around that concept.
Sure.
But it's really discrete diagnostic blocks using our knowledge of neuroanatomy to find the problem.
I like pain mapping. And what about the future, quickly? Anything on the horizon that you find very exciting?
I think it's just the fact that pain specialists are actually going to become more and more necessary, because evidence-based medicine is saying, look, we can't just give people pills, and we just can't do things without having a cause. We need to know what the cause is. So we're finding ourselves busier than ever, because pain is the most common reason you visit your doctor, and people need to know why they hurt.
And I would imagine that if we can find the pain, if we can aid in the pain going away, or at least managing the pain, this is going to be cheaper in the long run for everybody involved as well.
Well, yes, because again, there's controversy about surgery and costs and medications. If we're going to use medications and surgical procedures wisely, we need to know why people hurt and where they hurt. And so it's a great teamwork approach, working with our surgical colleagues.
Zero right in on it, and we can get it done.
Yeah, it's exciting business.
That's fantastic. Thank you, Dr. Bulger. We're going to take a short break, and then we'll be back with some more questions from you, the viewers. Stay with us. Welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on pain today, Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. That's 1-888-572-4411, or visit the website at southwestpaingroup.com. And we're going to start off, Dr. Bulger, with an email question. This comes to us from Ben from Plano. And Ben would like to know, is acupuncture a realistic alternative treatment to drugs in treating pain?
Well, actually, Ben, it is. In fact, during my fellowship training, I was fortunate to work with a very skilled acupuncturist, had Chinese training. In fact, she was Chinese. And acupuncture now, there's clear clinical evidence that it's beneficial. I find it most helpful with head and neck pain, not so much with low back, but you have to make sure you get an ethical acupuncturist that's been trained appropriately. But yes, it is effective. Now, it's not going to cure a major problem, but it can certainly be a useful adjunct.
Now, you believe in it now, but when you started, did you say, I don't know?
No. In fact, I got to tell you, I did not believe in it. But you know, life's a journey.
Sure.
And in medicine, I feel like I've learned more now. I'm much smarter than I was a year ago. And I think truly it does help people. I've had many patients benefit from it. I do believe in it now.
Fantastic. We have another caller holding Lowell from Carrollton. What do you have to ask the doctor?
Yes, my husband has been told that he needs a knee replacement, and he's had the MRI and the x-rays that reveal that he has a lot going on in his knee, and his kneecap, the back of it has become soft, and of course he has pain, but he keeps thinking he can do it, he can heal it some other way. And do you know of something that might help heal the knee pain and I guess the meniscus, because the meniscus is torn? Thank you.
Well, you're very welcome. Now, that's an interesting question. I have to tell you, there are some people looking at stem cells and things like that, but currently, to answer your question, Lowell, the best, I really think you're going to have to go with the recommendation of your sports medicine knee specialist, because if the meniscus is damaged and there's arthritic surfaces, there's not much we can do other than give pain medications for that. There's not really a nerve block therapy or any methodology right now. They're looking, some people are trying controversial things like Tiger Woods had the platelet-rich plasma and some, there's all kinds of things that are going on in pain management and orthopedics, but I think I would stick with what your board-certified orthopedic specialist recommends here, because that's an area that there's not as much we can do for that.
Now, I heard the question, but did he have a knee replacement, or was that a possibility?
I think it's being recommended, and she mentioned that his meniscus was damaged, and there's really nothing a pain specialist like I can do to help heal a meniscus.
Okay. Dr. Bolger's been with us again, brought us some new and exciting information. Dr. Bolger, is there anything that you would like to mention, because we have about 30 seconds left here, just to wind up the show?
Only to just encourage patients to make sure that when you find if you need a pain specialist, to make sure you're looking for somebody who's board certified. The American Board of Medical Specialties certifies pain specialists, and that's an important credential to have before someone starts doing things like pain mapping.
Dr. Bolger, always a pleasure to have you with us.
Thank you.
And if you have any questions, of course, you can call the number, continue to call 1-888-572-4411, or you can go to their website, www.southwestpaingroup.com. I'm Mike Berger. Hope you enjoyed the show. We'll see you next time.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.